Assalamu alaikum, welcome to Unscripted with Shanaz Saddique. As the Indian variant hits United Kingdom, we are perhaps going towards the third wave across the country, and in particular there are certain towns that have been affected. And that is a topic that we will be talking about today. And of course, our hearts and our prayers are with India, where the cases of deaths recorded have exceeded 300,000. Those particular cases that we are aware of are the official figures, and other figures suggest that those numbers are way higher when we take into account many of the rural areas, the villages and the smaller towns. We have got two guests today who are going to be joining me, and my first guest is Yasmin Qureshi, Member of Parliament for Bolton South East, Shadow International Development Minister, and also Dr. Ghulam Abbas, Consultant Spinal Surgeon and President for APPS UK. Now I am going to start with Yasmin Qureshi first. Yasmin, welcome to the programme. My question to you is to start, you are of course a Member of Parliament for Bolton South East. And it is important to remember that when we look at coronavirus cases, and in particular what is happening now in the last few weeks, the cases within Bolton in particular have become quite a concern, haven't they?
So, yes, Shanaz, they have. But I think the important thing is that hospitalization rates, that is the number of people admitted into hospital or people who are very seriously unwell with COVID, that is not anything exceptional or increased. This is kind of normal. So I think, to be honest, if that continues, people not going into hospital admission rates are kept minimal, not many people are kind of, seriously critical and well, then I think we'll be able to ride the variant, this COVID. I think it's also, remember that it's quite a lot of young people who are getting it, school children, and then it's their parents. So, and 8 people living in a house, very difficult to isolate if one person is found to have the variant. But yes, I mean, the figures don't look good, but actually I live in Bolton. I don't think people here are frightened. I don't think people are worried. But I think our hospital rates are steady, which is the good news.
Do you think the fact that the people are not worried, I mean, in your words, or not concerned, is worrying in itself? Because if you look at we've been looking at league tables, haven't we? And if you look at the league table for COVID cases, and in particular Northwest, Bolton is right there on the top. And Bolton and Blackburn, who's number 2, and I think Burnley is number 3, when I last looked at them, that Bolton and Blackburn have consistently remained there in the top, haven't they, in terms of numbers and the number of deaths that have been recorded?
I don't know if in the death levels necessarily the numbers are being high. This is why I say that although the infection rates are obviously higher per 100,000 in Bolton, but it's not translating into hospital admissions at the moment anyway. And when I say people are not worried, it's in the sense that, obviously as far as I can see, people are exercising caution. A lot of people are being careful. I mean, there'll always be some people who won't, but there's a lot of other challenges and issues that arise which can cause these spikes to vary. One of the most important ones is the ability to be able to self-isolate properly. It's all very well everyone will get 2 PCR tests done and stay at home. But a lot of people in these areas are on 0-hour contracts, on minimum wage, insecure work. If they don't turn up at work, they'll probably lose their job, or at least if they don't lose their job, they won't get any money. And although the government says we have put this isolation payment support in place, I know from constituents who've tried to access it, it's been impossible. And in fact, it was only a month ago in the newspaper that Bolton Conservative Council has the worst record of being able to give anybody self-isolation payment. So if
poverty is a big issue, isn't it, in terms of, or should we say, the inequalities?
Overcrowding is a massive issue. Also, a lot of these people, they can't work from home. Majority of these people, 95%, are people who have to go into the workplace. Factories, shops, hospitals. They're the cleaners, the auxiliary people, the people who come across the most people interaction. Often they use public transport. So a lot of these people, and there might be 8 people to a household in a 2-bedroom house. Say one person gets infected. I mean, how's 7 going to be isolating? What, in one room or in the garden shed? But they don't even have a garden big enough to have a garden shed. So I think it's all very well people. It's very easy to sometimes, certainly the government, to try to make scapegoat of people, but actually there's things that they haven't addressed. And Blackburn is not that different. It's got similar issues, and even Birmingham has got a lot of similar kind of issues of overpopulation, overcrowding. Sorry, not overcrowding.
But dense population. I'm going to bring in Dr. Ghulam Abbas here, consultant spinal surgeon and president of APPS UK. Dr. Ghulam Abbas, you've done a lot of work in terms of looking at demographics and poverty, and in particular because you work along many other physicians and consultants. We've known about the demographics, we've known about the poverty, we've known about the clusters of people and how overcrowdedness affects people in terms of their health, their education, etc. So why is it that these inequalities or these complex situations were not taken into account when looking at vaccine, when looking at coronavirus cases that became on the rise in particular areas?
So when this vaccination program was started, so rather than looking at these very important factors which you just mentioned about the multi-generational household and poor communities due to various reasons who have been left behind, the priority was to stratify people who are age-wise at a higher risk, or because of some underlying condition, they are high risk for COVID-19. So that factor, although we have been raising this awareness that we need to address that as a separate risk factor. But unfortunately, when you go through the risk stratification form, those people have been left out. It's only about the various government strategies focusing on the age group or underlying condition. So I think that is very important area to highlight. And the other thing is awareness about vaccination as well. That
I'm going to ask you in particular about the awareness of vaccinations. I know there have been lots of different projects across the country and multilingual campaigns. People have gone out onto the streets. We've got different faith groups involved. We've got mosques involved. And I'm going to ask you about, in particular, the issues that we've had in places like Bolton, in places like Blackburn, in places like Bradford, in other places where there is, in terms of minority ethnic communities that are heavily populated. Do you think there is an issue still when it comes to vaccinations and the take-up of vaccinations for those particular ethnic groups?
Yes, if you look at the data, despite our communities opening doors in mosques and other places of worship from ethnic minority groups, I think there is still a lot of work to do about the take-up of vaccination. But I feel that in UK, the people have actually taken this on board, and a lot of people have been vaccinated. I rarely have come across now any person who I know who has not been vaccinated in the UK. However, situation is very different in Pakistan, if you consider Pakistan as well. But I think we need to work with Pakistani authorities as well as the media groups, because even though it is surprising that you just have to send your mobile number and your ID card number and you will get vaccination date in Pakistan, and it is happening even in villages. But people just are either not aware about it, or they think it is some kind of conspiracy. And unfortunately, our people are sometimes very conspiracy minded and kind of read conspiracy into everything. And this is something which we need to focus on as well to educate our communities.
I'm going to go back to Yasmin Qureshi because you mentioned Pakistan, and I want to make reference to the recent information that we have. This traffic light system, Yasmin, I don't know. I mean, I'm trying to get my head around it, and it's a bit of a mess, isn't it? If I may say so, in terms of understanding it. So we have red, amber, and green, and we have those countries that are on red, and then we have those countries who are on amber, and those countries on green. And if you can sort of explain in simple terms, Yasmin, what is your understanding of it? Because I think people out there are getting it quite mixed up, really.
Okay, so red countries are countries where if you came from them, you have to quarantine in a hotel for 10 days. And that 10 days is not the day you arrive, it counts the next day. So it's effectively 11 days. That's the first thing. And you have to quarantine in these hotels. It's about £1,780 per person. I think there might be a smaller amount for children, but that's the amount. And as countries like Pakistan and now India and others are on it.
So there's currently 43 countries, is that correct? 43 countries, I think, yes.
At the moment, it may well be a few more, might have got added in the last few days, I can't be saying. But there's a website in the government which tells you exactly which they are. Then there's the amber list country. Now, this is where all the confusion occurred. There, if you're coming back from an amber list country, you have to quarantine but at home, and you've got to have 2 tests on day 2 and day 8. And that's needed. Then there's the green light countries, which are very few. There, when you come back, you don't have to quarantine at all.
I think it's like 12 or 13 countries that are possibly on the green.
They're very far away countries. The problem with the amber country was that what they said is there was a time when it was actually unlawful to travel out of the country. And as I understand the amber, what it is, it's not unlawful now, and you don't need a permission to travel, which is what you needed beforehand. But what they're saying is you should only travel if it's a necessity.
It's not recommended, is it? It's not recommended. Essential only, yeah.
The issue was, is it the law, is it guidance? As I understand it, it's guidance. And the Prime Minister, though, pretends it's all, everybody's clear, but he isn't, because he was confusing everyone himself. That's the green list, the amber, and the red. Can I just say, when Pakistan was placed on the red list, I did write a letter to the government and say, why? Can you give us the full reasons? Because at that time, the infection rates in India and Germany and other countries were much, much higher than Pakistan. And there was no South African variant in the Pakistan one at all, or anything like that. If anything, they just had the British variant. You know, they were, I never really got a proper answer to that.
I mean, Yasmin, there's been a lot of politics around that as well, if I may say so. And in particular, when it came to the comparison, say, between India, Pakistan and Bangladesh and what was happening with the traffic light system and also in terms of the flights. Now, if in the last few days, I know that some of my friends and family members have had to travel out to Pakistan because, unfortunately, there's been death in the family. And trying to get a flight out to Pakistan is just potluck. You may book a flight in the evening, and by evening, in the morning, and by evening you may have cancelled. But that's not the case when it comes to flights to India, is it?
No, I think it's still difficult. But I mean, you know what I would say, right? At the moment, because BA is not flying, as you know, so there's only a few airlines flying to Pakistan. But people are able to fly. So that's one of the reasons I think there might be a problem, is because it's relying on other airlines to be running flights. Whereas in India, of course, Air India still is working and operating.
I mean, Virgin have cancelled many flights. In fact, British Airways are now reducing their flights. I think where there was a flight every day, except for a particular day, from all the major airports, it's reduced to something like 1 or 2 flights a week. So what's that? Is there any explanation of that? But because when you compare it to India,
Shanaz, I think it's numbers. I think it's a numbers game. India is a population of 1.3 billion people. there's bound to be more travel to India from everywhere, not just, but British businesses as well and people like that, right? So 1.3 billion comparison to what, 200 million of Pakistan. Obviously, there's going to be a lot less provision. And because there's probably not as many people traveling, most airlines are probably finding it financially not any worth putting a flight on, 3 or 4 flights a day if they're only getting a capacity of, say, 1 flight. Whereas in India, a lot more, it's a bigger country, there's a big capacity issue. I think that's what's happening there, to be fair. I think it's a numbers game in that context.
Dr. Ghulam Abbas, I want to bring you in here in terms of the traffic light system and people's understanding. You being a consultant and involved with many practitioners across the country, what would be your advice to people when it comes to travel? Because what do you consider to be essential travel? We have a long list of countries who are on the red list, and then we've got the countries and we've only got something like 12 or 13 countries who are on the green list. I mean, I was just actually looking at the green list, I think, today, as of, I think, I've gone onto on the computer. Portugal, Israel, Jerusalem, Gibraltar, Iceland, Singapore, Australia, Falkland Islands and New Zealand, etc. If you look at those communities within the United Kingdom, not as many perhaps as we would see from other communities who are actually featuring on the red list. So what sort of advice would you be giving to people if they wanted to travel back home from those other countries that do appear on the red list?
So I would suggest, from my recent experience, actually, I have been to Pakistan in March. Just before Pakistan became a red country, I traveled to Pakistan. Even if it was not on the red list, it was absolutely nightmare to travel to Pakistan. It is not enjoyable. Why? You have to do series of tests here, you have to do series of tests over there, and all your travel experience and meeting your relatives and loved one is so much disturbed by this. As you might know, that I was on ventilator for 4 weeks last year due to COVID-19. And my mom was very worried, and sometime I thought that she did not believe people that I'm still alive. So I wanted to make sure that she sees me physically. So I went around to see her. But it does not make a sense to travel to a red country at the moment, even though it might come across that it is not a common sense based red, green and amber systems. But I think in the current scenario, if we are in, say, a decision making position, we will
I think we just come back to Yasmin.
to
Yasmin,
make sure that
we've got
public is safe.
Go back.
I can tell you that at the moment I have 3 return tickets to Pakistan, which has not been defended, or I have not been given any voucher. So I'm working on my travel insurance and other things. So because it's not just the physical aspect of travel, is it, Dr. Ghulam Abbas? You yourself have obviously experienced this, and you're somebody that works with charitable organisations there. So some of your travel is essential travel in terms of going to actually set up work there for work purposes. The financial element of it, you mentioned the COVID testing, having the test before travelling out and then booking them back. The hospital quarantine system. There's a lot of, you're probably adding on another £2,000 to your, adding on to your flight costs. That's not including any hotels or any other accommodation costs. We keep losing the sound system. I want to bring Yasmin back into this. The actual
financial costs, if I can ask you the same question, the financial elements of actually travelling out to some of these countries, in particular, if we focus on, let's say, Pakistan or India in those countries, is this something that you, as a member of Parliament, is looking at for your constituents, or as it's been something that has been raised in Parliament when it comes to the added costs of travelling out during this very difficult time?
So when I wrote my letter about the Pakistan being on red list, one of the things I mentioned is that it's such a short notice, people were allowed to go, and you know what, having to pay £1,700 and £1,800 per person is far too much for my constituents. The only answer I had was that they could, if the fit circumstances, could get a loan from the British Consulate, from the British High Commission in Pakistan to the website, and then they would have to repay that loan. I have to say though, whilst I understand people want to go to Pakistan, I genuinely think that people should only go if it is really a matter of life and death. Somebody, you know, your mother, your father, somebody is dying, or, you know, perhaps, as say, you need a medical treatment that you can't get in the United Kingdom, or there's a proper, legitimate legal property, you know, a case that you have to do. I have to say that quite a lot of our people are going to Pakistan for weddings. And with all due respect, I really do think that that is something perhaps I would urge them not to do.
But that's on the list of one of the reasons to be able to attend. I mean, even now with the easing of restrictions with the traffic light system, it's there. The government is allowing that. Public health officials who are working with the government are allowing that, aren't they?
Yes, absolutely. And so therefore, if they're allowing it, then the cost of it, they should have to pay for it. I mean, everybody now traveling to Pakistan knows exactly how much it's going to cost them to come back. Yes? And what, you know, I have a lot of sympathy, and I understand completely somebody's unwell or dying. I have to say that I would ask people to be, if money is an issue, then I don't think going to a wedding should be a priority, whoever's wedding it is. I think, and then
yes, sorry, Yasmin. What I wanted to ask you, in particular, the reasons for previously weddings wasn't something that was seen as essential, but yet the list and the information that is coming out. Do you think that this is perhaps a money-making ploy for the government in terms of the cost element? We've heard lots of media coverage, issues around during the fasting month, what was happening with food, the cost of somebody staying in a hotel, say for example, one of the lower end of the spectrums. I'm not going to say any names, but the cost of booking a hotel for 10 days and staying there, should it actually be £1,700 or £1,800 per person?
No, I shouldn't. I don't think it should be that sort of amount. You're right. But the government, I suppose, I don't know, maybe they're doing it as a deterrent. Maybe it is an element of profit making for people that they know. I don't know. But what I do know is that I think, you know, you said a lot of people didn't used to go necessarily to Pakistan for weddings. I may be wrong, some people did. And now let's be honest with you, a lot of people found this as a reason because they wanted to get out of the lockdown. They wanted to be going to a country where they could relax. And as the government gave the reason of a wedding to go. I mean, you know, I've been wanting to go to Pakistan. I've got relatives who are getting married, but I'm not going until everything is cleared. And I, you know, and I think we have to take some responsibility here.
I'm going to see if we can get Dr. Ghulam Abbas back on. I don't know if the sound system allows us to do that. Let's see. Yeah, ready. Dr. Ghulam Abbas, we've just been talking to Yasmin. I don't know if you could hear the conversation in terms of the actual cost of the hotels and the actual COVID vaccination itself is perhaps a deterrent for people to actually travel out. Do you think it's working, or do you think all the deterrents need to come in?
I think this deterrent, if they have put on, is working. And even though it might seem unfair, but also if somebody is traveling, you know, if we look at the scenario why Pakistan was put on the red list long before, for example, our Indian neighbor, because there were statistics showing that travel to Pakistan hasn't changed trend-wise before COVID, during COVID, and the time recently. So they wanted to make sure that people only travel to Pakistan or any other country where there is a risk, even though at that time risk in Pakistan was not that high. Unfortunately, recently it has been quite significantly high. But I think putting that measure in place, even though it might seem unfair, but I think it worked. If you see this country,
comparatively speaking, Dr. Ghulam Abbas, with India, it was highly criticised in terms of the government and the reasoning or a lack of maybe information that was available by people that asked the question. The delay in India being putting onto the red list in comparison to Pakistan. Do you believe that if it had been put on the red list at the same time as Pakistan, that we perhaps wouldn't see the surge of the Indian variant within the United Kingdom?
I agree. I think they should have put India on a red list long before Pakistan even, because there was significant evidence showing that way. However, unfortunately, things are not always guided by statistics, and they are guided by politics and the financial interest of various nations. And if you look at recent events, Prime Minister's visit to India was cancelled at the last moment, and they wanted to go ahead at any cost. That is not something which you expect from, if you see rational point of view in a national interest. But unfortunately, that decision was delayed. And if you see UK, even though we have slowly managed to walk out of this crisis at the moment, but we are not out. And the main reason for this is that our government has been slow in acting at various stages. And this country is a small island. And if you calculate the death due to COVID-related deaths in similar countries like Germany and rest of the Europe, UK has done quite well. Yeah, more than 100,000 people are dead in this small island. And these kind of measures which were delayed initially and later on, the measures such as this, where rather than data dictating what to do, the policies were guided by the politics and the financial interest. But if you look at the wider interest, if we are seeing a triple mutant in the UK now, that's because the red listing of India was delayed too much unnecessarily. That is a fact, and everybody knows that.
I mean, APPS UK does quite a lot of work with lots of different organisations. We just spoke with Yasmin Qureshi, who's still with us, and one of the things that she's saying is that we shouldn't be travelling out, even if the reasons are legal reasons, and there still should be caution when it comes to travelling out. What would be your advice in terms, and what is it you as an organisation are doing to educate people around travel and what is seen as essential travel, and where to go and how once they get to those countries, what their travel should be like within those countries, and their behavioural patterns should be like in terms of family networks and what they're doing there?
So I agree with Yasmin Qureshi about that there's no need to travel at all. If you have to go through these many barriers, financial, healthcare related risks, if you become unwell in a country who doesn't have similar system of healthcare as UK, why you want to take this risk during pandemic? You have to be realistic. You have to take these, if you are taking these risks, you need to be responsible for whatever you have to face, whether it is financial or other aspect. But unfortunately, the way we have been brought up in this country, that we sometimes rely too much on the government systems and forget to take personal control of our situations. So if I was giving you advice, I will say, don't go to a red listed country, whosoever it is, because number one, it is not financially viable and enjoyable experience as well as holidays experience. Number two, it is not safe. If you become unwell in, say, Indian subcontinent, wherever you are, whether it's Pakistan, Bangladesh, India, and the health system is unfortunately not similar as in the UK, and you have to pay hundreds and thousands of pounds to get a basic decent treatment when everything is free here in this country. If I went to, say, Pakistan, I only plan if I have to go due to work-related any commitments, or if there's unfortunately if there's anything, you know, an bereavement in the family or something like that. Even in a very few cases I've seen in bereavement cases, people are reluctant to travel because unfortunately the things for COVID-19 restrictions are not being followed in Pakistan and other countries similar to here in the UK. And because
I want to come back to Yasmin on this. In terms of people that are travelling out, Yasmin, do you think that the government really needs to do more to deter people? We've got the financial aspect, you've said, in terms of everybody moaning and groaning about the fact that they can't get flights, say, to Pakistan and India and lots of other countries, that travel has been restricted. Do you think that, do you agree with Dr. Ghulam Abbas that the government has been slow at every aspect and needs to do more?
The government have been slow throughout the whole pandemic. They should have locked down when they should have. They refused to bring in any testing before coming to UK until some months ago. However, now they have done the red list countries and, you know, the amber countries. I don't think they can do much more than that, because at the end of the day, the people who can come back to the United Kingdom are the nationals of Britain. So they can't exactly stop them from coming back. But by having a forced 10 days quarantine, therefore reduce the risk of it spreading to other people. And of course, the cost of it is very prohibitive. And I would say, you know, I was agreeing with everything that Dr. Abbas was saying, in terms of you don't need to go there, in all honesty, unless it's really the dire thing. The medical provision, they're completely, you know, you won't be able to look after properly. There's not many ventilators, for example. You know, you will not get the treatment that you need. Why put your family and everybody in danger unnecessary?
I mean, we've seen those horrific pictures, aren't we, out of India?
Can I say one thing?
Yes.
May I just say one thing? There's a very famous hadith of Hazrat Ali, which says that, you know, if you got a plague in a country, you don't leave it, and you don't go to a country which has a plague either.
It's like containing, isn't it? Containing.
So they say, stay within your own parameters and travel when it is safe to do so. And I'm sure, inshallah, you know, give us some more months, right, with the vaccination and everything, and everybody knowing how to deal with this virus.
I mean, coming back to our home situation, if we actually follow that hadith, it talks about containing any kind of plague or illness or disease, and not just on a macro level, but also on a micro level. So already people have started to say, and if I come back to Bolton, that we should not delay the process and put Bolton into lockdown, and put Blackburn into lockdown, and perhaps even Burnley into lockdown before it gets out of control. Would you agree with that?
No, I think there's a difference, right? I mean, in the sense of Bolton, Burnley, I mean, these are very easily commutable distances, right? You lock down in Bolton, and all you have to do is literally cross over the road, and you are into Bury or Walkden or Atherton or wherever, where you can then go.
Yes.
So these kind of lockdown actually just don't work because they're so small. And because these borders are not exactly policed, are they? The boundaries between Bolton and other parts are not policed.
What should they be, Yasmin? I mean, I'm actually thinking of quite strong procedures here.
We're not a police state yet, and I don't think we need to do that, especially as our hospitalization rates are very steady and okay. I don't think we need to go that drastic. But I
What
think,
would
you know,
be the levels though? I mean, this is where, please, Dr. Glambas, do come in as well. I'm asking both of you that if you actually look at the first lockdown and then the second lockdown, and in terms of maybe the sort of parameters that were set, if we go along and we all seem to be in agreement, and many others would agree and some would disagree in terms of the government was slow to react or act, then if we have a reactive government and things are slow, should we not move those parameters? And where we've got now heading towards a third wave is perhaps to have a policed state, have the army more involved, have patrolling of certain towns, and make sure that we contain, control, and try and really control before we get to a situation where we've got a crisis again.
Yeah, I agree. Actually, if you look at statistics, they are quite alarming. More than 100,000 people dying. If this death was due to any other non-accidental reason, for example, say any accident or any other activity, whether it is terrorism or war or anything, government will make very strict rules about it. But why not corona? Especially, I am hearing the news about triple mutant in certain parts of Yorkshire, for example. Yeah. So anything which bring restriction of movement and encounters, and therefore restriction of spread of disease, should be considered and should be implemented. Now, there's nothing, you know, we should consider not applying that, whether it is not about civil liberties, it is about actually protecting the public and protecting the livelihood. If you see in the last couple of years, what has happened? A lot of businesses have gone bust. A lot of people who were breadwinners have died. I would not have been here. You know, I accidentally, you know, I'm very thankful to Allah Ta'ala that I am around. And what I think these days, you know, I was on ventilator for 4 weeks. Hardly ever anybody survived after being on ventilator for 4 weeks. So what I feel that as a survivor of, you know, COVID situation myself and a healthcare professional as well, I think there should be stringent measures to contain the disease, whether it involved local lockdown, police, or military. This is a national threat, and it has destroyed our economy. It has taken more than 100,000 lives, and a lot of those people were actually very would have been around if this would not have happened. And I think we should do whatever it takes, but we should always give a little bit of benefit of doubt to the government as well, because it is a brand new situation. They are trying to do whatever they can to get information, to manage the situation, to the data they receive, but they are not always getting it right. But
Dr. Glambas, if I may disagree here, it's not that new, is it? Because if you actually think about it, we've had more than a year and three different, this is the third wave that we're actually moving towards. And there is grave concern that if it's not handled properly, that as we ease and work towards opening things up, before we know it, we'll be closing things again. I want to ask this question to Yasmin Qureshi. Why is it then that the Shadow Cabinet is not putting that kind of pressure on the government to act more quickly and swiftly? Because they've argued that they've been so slow so far.
Well, the opposition has. I mean, we were calling for lockdown, for example, last year. We were calling for tests. I mean, in October, when there was the school holidays, you know, the week they get, half term, we said, Keir Starmer at PMQ said to Johnson, please lock down for this, do a lockdown circuit, break the circuit, because loads of people are going to be mixing and meeting, and it's a good time to do so because a lot of people will be at home as well. He didn't listen. Then come Christmas time, we said don't allow for this mixing. Again, Johnson didn't listen. On testing, we've been saying all these things. So we have. It's just that this government with this big majority doesn't listen. Simple as that. The opposition, we've been talking about it for a long time. And not just the lockdown. This is a prime minister who in the early days missed 5 Cobra meetings, emergency meetings, because he's busy writing a novel on Shakespeare. This is a prime minister who's, to be honest, he's an absolute disgrace. Yeah, I don't know why he's so popular, because he just lies his truth. He's been incompetent, and he's just lied.
Is he popular, Yasmin? Because if you actually compare him to the alternative, Sir Keir Starmer, that people are trying to decide which is the best or the worst alternative, that people believe that the data is there, the health officials are there, that perhaps the opposition would do no better or worse in this situation. Is that the reality of the situation?
Well, it may. You may be right. The opposition may have done worse, but I don't know. But I think we would have been. I think the opposition would have been more like New Zealand, where Jacinda Ardern, the wonderful lady, did an immediate lockdown, as did South Korea. Immediate lockdown, and guess what? They're back to working now. Our Prime Minister, he wanted herd immunity. That was his policy at the beginning. We didn't have even people tested before flying into this country, the requirement to do testing, right? Pakistan had it back in, quite early on. Yes. By December 2019 or something, Pakistan had it. But we didn't get it until some months ago. And now we've been saying these things to be done. So I think, we would have handled it differently. I think we would have been, personally, I think we'd have brought a stricter lockdown much earlier.
We are coming to the end of the programme. Dr. Ghulam Abbas, you being somebody with a health specialist background, and still obviously working within that particular sector, you've seen people come into the hospital, you've seen people die, you yourself have gone through it yourself, where you've been on a ventilator. The situation that we have now, where there is rising numbers, we're talking about a third wave. If you were in government and you were an advisor to the Prime Minister, what would you be saying in terms of what is happening now and what needs to be done?
So first thing is we should close our borders to any country we suspect there is a threat from.
Totally close.
Irrespective
of
politics,
totally close?
Irrespective of any financial interest. Number 2, there should be a local and smart lockdown systems in place. Wherever you identify cases, there should be a lockdown in that particular area. So that.
And when you mean lockdown, Dr. Ghulam Abbas, can I ask you, what do you mean about lockdown? Should people be staying at home, not allowed to go out at all, shopping, etc.? Support should be given, or can they, travel within their own vicinity?
So if it's just like they put a relative lockdown in various places before. So local lockdown means no person, as respected Yasmin Qureshi, the member of parliament, was saying, and just like Hazrat Muhammad's hadith summarized it, that no person should leave the area where there is a disease identified, and no person should enter in that area new. So that this is very much definition of a control of pandemic through quarantine measures. So that's what need to happen. So wherever, irrespective of which part of UK it has happened, so they should contain and they should find the source of this, the root cause analysis, where this case came from, who are the people in contact with. So they should then isolate all those people. I'm sure they are working on it, but local lockdown, opposing a local lockdown is not a good idea. It should be all the achievements we have done so far with the triple mutant and other threats which are coming through will go if we let it slip through, if we don't do lockdown.
I mean, if I can come back to you, Yasmin, on that, if that sort of system came in where we felt that local lockdowns or smart lockdowns, whichever word we use, would you agree with me that perhaps the only reason or the concern that people have is what you raised right at the beginning, that these particular communities where we would perhaps have to do this are the ones with the highest level of poverty, the ones that are on a daily wage with 0 hours. It's fact the actual financial implications for those communities and weighing that up with the health consequences of those communities.
Well, here I very respectfully disagree with Dr. Abbas. I don't think we should have a local lockdown. I think people in Bolton already suffered massively. I don't think kind of lockdown just to them is right. I don't think it'll, and more important, it won't work. That's the thing about it. Lockdowns are great if they are in a big geographical area, but when they're in small areas, they haven't worked. So some time ago, we put in a lockdown, and all it did was people, you know, since you can only say to people to exercise caution, but people just travelled across the road and went into, you know, restaurant, pub, shops or whatever, and went to visit people there or went to another point. I think local lockdowns are just not workable, and therefore I think they sound like a good soundbite that governments often use to show that they're doing something, but in real terms they're just not workable in a local level. On a bigger geographical, it's a different story.
So would you favour, so say for example we've got Bolton and then we've got Blackburn, those areas, so a regional or even a county-wide, would you be in favour of a county-wide lockdown?
Well, I mean, if they, for example, said, oh, I don't know, you can't go out of up into Birmingham or something, I don't know. But I'm not sure lockdown is going to work now. I mean, as I keep saying, right, our hospitalisation rate, I think it's important to watch that. The hospitalisation rates are very, very stable. People who are very unwell from it are very few. And I think if that's happening and the hospitals are coping and doing properly, then I don't really see any reason to do the lockdown. I think, and to be honest, I think most people are fairly sensible. Even now, people, right, you know, even though you're allowed to have visitors at home or you should meet them outside, a lot of people are still, I know, are still being cautious. It's like gyms and house clubs are open, but a lot of people I know are still not going to them. And there are people still, you know, when they meet are putting face masks on. So a lot of people are already exercising caution. I think we've reached a point where actually people are just now fed up and people are not, you know, going to be abiding it. I think we just need to allow people to have common sense. And I think, you know, if I mean, at the end of the day.
A final question to both of you. Do you believe that people, the fact that they are fed up, the fact that they have gone through 2 national lockdowns, the fact that we are now moving to better weather and you know, the easing of it, and we're hoping that all the restrictions will be lifted. Both of you, the final question: do you believe that the population out there will use their common sense beyond their emotions?
I think they will, because I've seen it. As I said, there's loads of people I know who desperately want to go back to gyms, join a gym, but they're not doing so because at the moment they still think that they need to give themselves time and that more people need to be vaccinated. I still see people, you know, wearing face masks even on the streets. There's always some people who will not be as cautious, but I still think a lot of people are, and I think one of the things, as I understand, the rates are high amongst young, and it's always very difficult, kind of the exuberant young, and of course they're the least, most of the time, the least vulnerable.
And before we finish, Dr. Ghulam Abbas, would you agree? Would you agree that we leave it to common sense and maybe not intervene in the way that some people are saying out there?
I personally think that even if it is you know, symbolic to do a lockdown. For example, I was traveling a couple of weeks ago, and it was just before 17th of May. Basically, I went to a hotel. I checked in, and before I checked in, they called me that are you traveling for business? And I said, yes, I was, and they actually forced me to bring a key workers letter from my employers so that I can prove myself that I'm not just holidaying there. But if you look at
we have
the
come to
British
the end of the
public,
program. I want to thank both of you for your comments and the discussion that we've had today. So lots of things to think about there. We've had a member of Parliament together with a health official who given their view on what's happening with the third wave that we're perhaps heading towards in the United Kingdom. Today we have been talking about that. You have been watching Unscripted with Shanaz Saddique. Assalamu alaikum.